Good day. So in today's lecture, we will talk about the classification of biomedical devices and instruments. So the World Health Organization defines a medical device, this is the short version, as an article, instrument, apparatus, or machine that is used in the prevention, diagnosis, or treatment of illness or disease, or for detecting, measuring, restoring, correcting, or modifying the structure or function of the body for some health purpose. Typically, the purpose of a medical device is not achieved by pharmacological, immunological, or metabolic means because the last sentence here refers to a drug, which is a pharmacological method for any of those stated above, but takes the place of using substances that reacts with certain body systems. Okay, so here is the longer version of the WHO definition. So the medical device means any instrument, apparatus, implement, machine, appliance, implant, reagent for in vitro use, software. By the way, here, reagent for in vitro use, when I talk about in vitro, this we say in vitro is in a glass. It's not in vivo. So the reagent here should not be placed inside or imbibed inside the body, but rather a reagent, because when we define a reagent, it's a chemical substance. So the chemical substance here, under a medical device, it should not be imbibed by the person. So for a medical device, the reagent for in vitro use here falls under substances that are usually used for sanitizing the medical equipment. So that those examples, those are the things that fall under the reagent for in vitro use that is under the medical device definition. So meaning for example, the hypochlorites that are used to sanitize medical equipment, they fall under the category of medical device rather than a cleaning reagent or anything. So that means they are also regulated and applied under the rules where other medical devices are under. So anyway, continuing on, so it's software, usually in health informatics, documentations in the hospitals, etc., even research. Materials or other similar or related article intended by the manufacturer to be used alone or in combination for human beings for one or more of the specific medical purposes of diagnosis, prevention, monitoring, treatment, or alleviation of disease, diagnosis, monitoring, treatment, alleviation of, or compensation for an injury. So when we have a compensation for an injury, usually those are prosthetics. Those are some examples. Investigation, replacement, modification, or support of the anatomy or of a physiological process, supporting or sustaining life, control of conception. So even say contraceptives that are not falls under the category of medical pills, for example, it's not a medical device. We are here talking about physical barriers for conceptions. Disinfection of medical devices, providing disinfection of medical devices are usually the reagent for in vitro use. In vitro is glass, so they are not their intended use is for equipments, glasses, medical equipments, etc. And then last is providing information by means of in vitro examination of specimens derived from the human body. So even laboratory instruments that are used, for example, when you go to the clinic for a routine checkup, the analysis or the laboratory test, the equipment that are being used there falls under a medical device and does not achieve its primary intended action by pharmacological, immunological, or metabolic means. So the defining line, or sorry, the dividing line between a medical device and a drug is a medical device should not have an action by pharmacological, immunological, or metabolic means in or on the human body. So that is your definition of a medical device. So let's say, for example, is a lotion considered a medical device or a pharmacological, say it falls under drugs? So we can say that since a lotion is supposed to be absorbed, or even if it's a topical lotion, so you have some sort of absorption there by the skin. So it falls under an action that has a pharmacological, immunological, or metabolic means. So it's not a medical device, but rather it's a it falls under a definition of a drug. So we have several classifications of, actually, there's a very wide range of medical devices. You can see from the definition itself. It has a very, very long definition because it has a wide, there are many different types of medical devices. And so the FDA, which the US FDA here, which is the leading, usually most other countries for makes you the USDFDA as their standards or follows along what the USFDA has. But the USFDA has a classifications. So we have class 1, class 2, and class 3. So the basis of this classification is on how strict the implementation of controls should be. So under class 1, so instead of classifying the medical device as instrument, reagent, etc., so they just simply classify it based on how strict or rigorous the regulation for each type of medical devices, because there's a large range of medical devices, and the medical devices have again a large range of application. So they can be used outside. There are some devices that do not really come in contact in vivo, so that means they are laboratory for laboratory use, but they are not basically they are laboratory use but not to be used in direct contact with the person or the patient itself. While there are some devices that are implanted inside the body of a person. So that requires a very strict control, while the former is not so strict. So that is the basis of this classification. So for the class 1, it's general controls. So these are even non-powered medical devices. So the specific example here is a non-powered, although it's cement mixer, it's a non-powered medical device because the fact that you have a power device, it utilizes electricity or any other power source. So there might be some cases of mishandling, or there's actually some risk involved, of course, in the utilization of that power. So class 1, non-powered medical devices. So for class 2, again, general controls and some special controls, but examples, these are devices that also are powered. For example, we have a wheelchair. So the normal wheelchair where the a second person is supposed to push. So that's under class 1. So it's a non-powered medical device. Whereas a powered wheelchair, for example, it's an electric wheelchair. You just push a button and it goes around. So that's a powered medical device that falls under class 2, because the fact again that you have a power supply, it presents some risk. And then the last one, the highest classifications, these are devices that requires very rigorous amount of control. So they can be transitional medical devices, pre-amendment medical devices, or not substantially equivalent post-amendment medical devices. So let's look at some other examples. So here is a different graph, but again, class 1 is the low risk, class 2 is the moderate risk, while class 3 is the high risk. That means the risk here is danger to the individual or the patient using the device in case something goes wrong. So for the low risk, these some examples here are adhesive bandages, band-aid, for example, wheelchairs that are not powered. And then tongue depressors. When those are basically popsicle sticks that they are used when the doctor's checking you. Anyway, so these are low risk devices. They do not present they present very minimum danger to the patient. Whereas the moderate risk, they include contact lenses, catheters, needles. So contact lenses, because they are in contact with, of course, your eye, which is very sensitive. Needles, they pierce the skin. So if you have a need, it presents a moderate risk because it can be a source of infection. And of course, the spread of some diseases like HIV. Catheters as well. So because some catheters, although they are on generally the surface, is basically inside, some of them have to go inside the body. And then you have the high risk. The high risk examples here are the pacemakers. It's quite high risk, because of course it controls heartbeat. So if there's something goes wrong and the pacemaker malfunction, can actually kill you. So basically those are the high risk. So if something goes wrong, it can result in the death of an individual. So general controls, because it's a wide variety, so it encompasses all these different risks. So low risk and moderate risk include some exemptions, and then moderate risk and high risk requires some special controls. However, the high risk absolutely requires pre-market approval. So here is the classification and some examples here. So under class 1, we have some thermometers. So I think this is centrifuge, either a centrifuge or laboratory equipment. So these are also laboratory equipment. You have the wheelchairs, and I think this is a cast support. So they present minimum danger to the patient. And then class 2, because moderate risks are pretty wide in their scope. So you have class 2A and class 2B. So class 2A includes sphygmomanometers, some powered devices, even hearing aids, and syringe, needles, and syringe. But for some class 2, we have here your contact lenses. I think this is some sort of scopes. And then, of course, the X-ray equipment, because again, it releases very strong high energy radiation. So it might pose danger if something goes wrong. And then, of course, the highest risk are implants, prosthetic devices, and even pacemakers. So here are some regulatory implications. So classification of devices and the regulatory implications. So here, for example, site of applications. So these are not only not restricted to the US FDA, but as you can see, regulation from other countries, especially here in the European Union. These are actually international regulatory bodies. You have ISO and then EU classifications. So in terms of the site of application, if it's not touching the body, it's an accessory associated with biological samples. That means laboratory equipments that are used to test or in laboratory testing or analysis of samples, of patient-derived samples. And then acting on a patient, but not necessarily touching the body. So these are the regulations. So, excuse me, ISO 13485, ISO 10993, and ISO 40971. And then if it's applied to the surface of the body, but not attached, either attached or not attached to another device, and whether electrical or not. So here are these are the regulatory controls that are applied. And then if it enters the body, whether through an orifice, through the surface, or implanted, again, we have a different regulation or regulatory guidelines. And then for time of use, whether it's a transient, it's classified either as repeated or single use. So you have these regulations, temporary or permanent. And then if it's powered, so usually inactive or non-power device, not so much regulated, but actively powered device must have international regulation, or regardless whether international or not, it must be well regulated. So here is, if you want to apply for an US FDA, you need to first properly classify your device. So their website here provides a proper databases so that you can have an idea on how, if you do not really know where to start on how to classify your medical device, so you can search the database for any other similar devices. And for the Philippines, the application for medical devices is under the Department of Health. And however, for the product registration, there is a requirement that this, if you want to apply, uh, you must have a company that has a valid license to operate certification before you actually apply a certain product. And then these are from the website of the DOH. Actually, I looked at the on this link, however, it was a dead link. So I cannot show you the actual application site. But basically you apply at the Department of Health, and they will be review and evaluate your device. So that's it for the different classification of biomedical devices and some regulating bodies in this in the approval of a medical device.